Welcome to Giving Tuesday. Part of the mental health hour, we'll be having someone amazing tell us about great work that she's doing towards mental health here in Nigeria, where I know her to be from. Hi, Hauwa. It's nice to have you on.
Hi, thank you. Thank you for having me.
Hauwa leads She Writes Woman, which is an amazing mental health organization based out of Nigeria, doing great work around strengthening mental health, well-being, and awareness around this cause. Please let us know what you do, who you are, and what you have for us this given Tuesday.
Sure. First off, my name is Hauwa Ojeifo, and I think the first thing about me is that I'm a person that lives with a mental health condition myself. I was diagnosed with bipolar and post-traumatic stress disorder from living partly from having multiple sexual violence experiences as well. And so I went on to create my organization, She Writes Woman. Um, and we are a movement that gives mental health a voice in Nigeria by empowering people who actually live with mental health conditions to tell their own stories, to co-create the solutions, and to advocate for their rights. And so, we do that in broadly two ways. On the one hand, we're creating support services, what we call Safe Place Nigeria. We have a 24/7 toll-free mental health helpline that everybody could distribute the number everywhere. So wherever you are in Nigeria, you can call without having credit on your phone. You can call as many times as you want. You can call as long as you want. And the fantastic thing about it is that we're empowering everyday people to have access to mental health professionals like just from their mobile phones. And I think it's important to set context. In Nigeria, we're looking at a country that has, a declining number of psychiatrists. The last time, there was a major figure, it was about 250 psychiatrists to about 200 million people. So you see that great gap there. There is a huge deficit of mental health professionals, and it doesn't even have to be psychiatrists that we're talking about. How do everyday people get access to mental health professionals? By calling a 24/7 toll-free helpline, 0800 800 2000. You get to speak with a counselor, a trained counselor immediately. So that's 0800 800 2000. Another thing we're doing is ensuring that people have access to teletherapy. So that is therapy, but using using technology to be able to achieve that. And so again, people can also access that. You can go to the She Writes Woman website, shewriteswoman.org, and you can set under our programs and services, and you can see how to book a session, and you just book and you show up, and you would have a therapist on the other end, willing to talk to you again multiple times, unlimited, and you can do that over and over again. So at the end of the day, that is what Safe Place is about. In addition to that, we're trying to ensure that the accurate information and knowledge about mental health is being disseminated. That we're using storytelling to retell the narrative around mental health, because a lot of times it's an incomplete story, right? It's the story of the person on the street, or the woman who is like dirty by the side, or what we call the mad person, and things like that. We've heard the stories, we've laughed at it in our comedy shows, we've heard the framing in our news, we sing and dance about it in songs, and so it's important that people who actually have lived experience can begin to tell those stories, so that we can reprogram and reframe it, and we can humanize mental health, so that we don't see it as an us versus them kind of situation. We realize that all of us have a mental health. So on the other hand of our organization is where we have our advocacy. This is where we have policy and legislative influence. So whilst we consider Safe Place a bottom-up approach, we consider our advocacy a top-down approach. There is only so much we can do as an organization or civil society in ensuring that we reach the furthest behind first, and ensuring that the people that are most, affected are, have access to, receiving mental health care. We're looking at a country where there is no mental health at the primary health care level, and where you have over 60% of the population living in multidimensional poverty. So these are such important statistics to really understand what is really going on. Well, every time we problem solve for, mental health programming and things like that, we come to the realization that if we do not solve a poverty problem, we cannot solve a mental health problem, because you cannot self-care your way out of a mentally unhealthy system. And I always like to say that over and over again. No matter how many self-care tools you use, and how many self-help tools or books you read, we're only as healthy as the least healthy person within our environment. And I think COVID-19 really gave us a bit of context on that, because if any other person is vulnerable, it means you're vulnerable as well. You can do all the meditation at home and feel like, oh, I have my security, or I have my light, I have my water, I have my very lovely bed. And then you come outside and you see that the frustration is hot. It's going to touch everybody, so bottom up, top down. And the advocacy is so important because what we're really doing is not even something that should be so radical. We're really holding the government accountable for their commitments that they've made internationally and holding them accountable for the laws that they've created. So, for example, we're looking at in Nigeria prior to 2018 that states that I, as a person with a mental health condition, I cannot hold political office. I shouldn't be allowed. I mean, I cannot own property and things like that because I'm considered insane or not of sound mind, and things like that. And when we begin to shift away from mental health as this illness, that people need to solve and cure these people, and everybody seems to know everything they need to do for these people more than these people. When we move away from that to really realizing that what the real issue is that the environment has cultural and social barriers that disable people with mental health conditions from fully achieving their potential on an equal basis as other people. Because if a society says that, I mean, and we're looking at statistics that say about 40 million, some statistics say about 60 million Nigerians live with a mental health condition, according to the Federal Ministry of Health. We're looking at a huge population of people, and so it's not so much about, oh, let's go and kill all of them, or let's send them to institutions, or let's lock them away, and things like it is about how do we ensure that they have access. That is the fundamental human right, to have access to the highest possible quality healthcare that they can have access to. How do you ensure that they can participate in politics and social life and economic lives on an equal basis as other people? How do we ensure that they are not just medicalized as opposed to looking at the psychosocial aspect, of their condition? And so that's what we do in advocacy. We're going back, we're interrogating those laws, those policies, those practices that disable people with mental health conditions or people that interact with the mental health care system as well. So, for example, in 2020, you would say, yes, it's laudable, but it really also sets the stage for where we are at as a country. In 2020, I was the first person with a mental health condition to testify in that capacity before the National Assembly on the rights of people with mental health conditions in Nigeria. And that was on the occasion of the public hearing of a mental health bill, right? And this bill was a bill that's pretty abusive. It was a bill that we believe as people with mental health conditions, we didn't have sufficient consultation with regards to the bill. And that is the fundamental aspect of what we do in terms of advocacy. It can pretty much be summed up in nothing about us without us. You do not get to create laws. You do not get to create policies. You do not get to champion mental health without we who have lived experience championing it, being on the table, sufficiently consulted, having meaningful participation, not just, oh yeah, we had a service user come to tell us, oh, we have a seat here, not just tokenistic, act, but really and fully being able to, influence things that affect us. And so those are the two aspects. And beyond that, we have gone on to influence, speak at the United Nations, the opening of the United Nations Conference of States Parties, influence policies and policy direction at the World Health Organization, the United Nations, just to ensure that people with mental health conditions are treated with dignity and their liberty is preserved, their fundamental human rights are preserved. They are able to be socially, culturally, economically empowered to realize their fullest potential within a society, and their rights are protected every step of the way. And so when people want to do work that has to do with mental health, there's so much, there's a range of what you can do.
Yes, Hauwa, tell us about this range. Tell us about this range. What can people do, especially which is Giving Tuesday, because you've spoken so eloquently around, what affects every single family. I can assure that there's no family that doesn't think and say, oh, I have a family member that I feel might have mental health issues, but We don't talk about it as much. And so I'm really glad that you are here today. And I know there are so many people who are tuned in, who might be watching this and want to say, how can they help? What can they do in their daily lives as corporates, as nonprofits, for example, as family members? What can people do? And how can you be supported also, right? On a day like this? Yeah.
Yeah, sure. I would start with corporates and groups generally, and that's because I feel like there's a lot that can trickle down. I believe that groups generally, so in the workplace, there's a lot about mental health that we need to start talking about in the workplace. We need to institutionalize mental health. Begin to take it as seriously as we take physical health. Because even when we talk about non-communicable diseases and we talk about mental health underpins a lot of physical health issues. And that is something that we tend to miss a lot. A lot of people with physical health issues have underlying mental health issues that aggravate, predispose, or amplify the issues that they have and make them go from acute to chronic issues and things like that. So we need to start talking about mental health in the workplace beyond just health talks. And like I'm shading here and there, but that's the truth. Many corporates are all about, come and talk to us about mental health. It's a fantastic first step, but please begin to invest in the process. Really care about it. Like, what can we do? Do we need to have an in-house counselor, somebody that we can contract you to say, oh, come in and they have access to you. We want you to sign them up onto a program and things like that. Make it something that is explicitly available for employees. Make your environment a place that people can show up to, and they can also be vulnerable and they can tell you about their mental health. And that is one of the biggest ways I would say that happens is by employers also being able to share about their mental health. Because when they share about their mental health, they're able to break down the barrier and let employees know that, okay, I can show up and I can be seen here. A lot of times we think mental health is all about the illness and the extremes. But the truth is that if you've ever known what it's like to grieve, or if you know what it's like to have immense uncertainty in your life, if you know what it's like to not be able to sleep well at night, or to get very little sleep, or not to sleep deeply, or not to be able to sleep all through the night, or you're having issues with your eating patterns and things like that, or there are times you're just very irritable, and sometimes in the workplace they're all like, yeah, we know that one person that is like very on edge and they can just a ticking time bomb. These are things that we need to realize that it is a myth that people can drop their personal lives outside when they work, when they come into work. It's just not possible. We are whole beings, and so we need to begin to start looking at how we can invest in the whole person when they show up at work. Which, by the way, they do spend significant number of their waking hours at work, more than any other place within other aspects of the human life. So that is for organizations, for their staff. Broadly speaking, I think organizations should begin to adopt mental health organizations or civil society organizations that they can sponsor and they can groom and they can build their capacity and they can invest in. For example, I think it would go a very long way. Mental health organizations seem to be left behind when it comes. It's very easy because a lot of times you want to be able to put your signage somewhere and say we did that. And so when people walk, it serves you as as an ad or something that boosts your social currency as an organization. But there are other ways to also do that, even if it's on the digital sphere. Let your organization be known to invest in wellness and not just the other types of wellness like slimming down and things like that, but it's also in how am I ensuring that, oh, okay, you can say, oh, this year we were able to fund 3 counselors for this organization, and those 3 counselors went ahead to support 5,000 people. That is amazing. Because just look at the statistic I mentioned earlier. We're looking at a country that has about one psychiatrist to about 1 million people thereabout, and that's just alarming. And it tells you that there's a statistic that shows about 80 to 90% of Nigerians do not have access to the mental health care that they actually need. So it tells you that there is a huge deficit. How can you fund the deficit? How can you fund organizations that are standing in the gap? How can you say, for example, oh, She Writes Woman, you have a 24/7 helpline. We are, I don't know, maybe a telecommunications organization, or we have a customer care team. How can we platform you there to ensure that we can integrate or better your services and things like that? Sometimes it's not just about money. It's also about the capacity. It's about investing in the technology. It's about investing in data, and things like that. And so I think we have a lot of lost opportunities as far as that is concerned. Now, when it comes to individuals, again, you can give. SheWritesWoman.org, click donate. shewrightswoman.org, then click donate. It's there. You can give financially. But I always encourage people go beyond that. As for investing in yourself personally, you need to begin to scrutinize your own lifestyle. And I say this like in reality, recognizing that most people do not have the privilege of actually having that scrutiny. Like I said before, when you're in an environment that is all about flight or fight, when you're fighting for your survival, it's hard for you to begin to thrive and begin to think about, oh, maybe I feel this way. You don't have the time because you haven't eaten. We only need to look at Maslow's hierarchy of needs. If you don't have food and you don't have security, and you don't have clothes and you don't have sustenance, how are you going to think about self-actualization and self-fulfillment and peace of mind and things like that? Those are lofty things. And if you can't think about it, it's a privilege. So think about it, scrutinize your life, scrutinize your bedtime, make sure you watch what you eat, make sure you're looking at your bedtime routine and your waking routine, what you read, what you consume, whether it's through your mouth or your ears or your eyes, or whatever it is. Look at all of those things. But ultimately we need to realize why we need to also invest collectively in advocacy, because advocacy is what ensures that all of us are getting the wellness together. We're getting that access to wellness together. It's not just about the privileged person doing their yoga at home. It's that when you go out, you feel calm as well, because everybody is also operating at that level because they have access. Imagine if there was mental health at the primary healthcare level. We can hold our leaders accountable, to ensuring that. And that's where the advocacy comes. So you can always donate at shewrightswoman.org, and then you click donate just right there in black. Yay.
Awesome. So inspired to hear your story and the background of the idea and the movement and the things you're doing. Incredibly wonderful. I've had the privilege to also interact in such a space. And one thing that I found as a very useful resource, especially a generosity resource, is the social networks that we have, especially for women. They provide us spaces to just declutter and have conversations and group counsel. And I want to appreciate that today and congratulate all the women for providing us these safe spaces. And just the notion that generosity is also a healer and does come through in supporting everyone's mental health. And I can't wait to see us having this conversation again and again and again, not just within Nigeria, but across the continent, across the world, on how generosity is coming through for us as individuals, but as a collective. So such a pleasure meeting you, Hauwa, and I really look forward to connecting with you. And thank you so much, Emma, for guiding the conversation.
Thank you.
Happy Giving Tuesday.
Happy Giving Tuesday, everyone. Thank you so much. Happy Giving Tuesday, White Woman.